All right, standard precautions are in place for this skill. As you can see, we already have our patient on high flow oxygen. This patient is experiencing respiratory distress, and signs and symptoms of a respiratory emergency would include things such as shortness of breath, dyspnea, tachypnea, and perhaps even retractions and/or circumoral cyanosis. This nebulized medication treatment is used in many instances for patients who have respiratory diseases such as asthma or chronic obstructive pulmonary disease. Our next step is to call and obtain a physician's order for this procedure, and assuming that the physician gives us an order, we're going to go ahead and next gather our equipment. The equipment that you're going to need includes the nebulizer itself, which is here, the medication that you're going to administer to the patient, as well as the equipment necessary to take the patient's vital signs. All right, I'm going to reassure the patient, sir, we're going to do everything we can to take care of you, and we're about to give you a nebulized medication treatment. And what that means is we're going to put some medicine in this bowl, run some oxygen or air through it, causing it to create a mist that you'll inhale and exhale slowly, and that will hopefully help your breathing. Okay? All right, I'm going to now assemble my equipment, and I'm going to begin by first checking my medications. You always want to assess any medication by using the 5 R's. Make sure that you have the right patient, the right medication, the right dose, the right route, the right time, and make sure in some instances that it is the right concentration. And this medication comes in 2 forms, either a concentrated version or a pre-diluted solution. If the physician has ordered a pre-diluted solution, you simply take the top off the medication, dump it into the bowl, and you're ready to administer the medication to your patient. If, on the other hand, you're administering albuterol in a concentrated dose, you have to then dilute it. So you would simply take your medication, drop the amount that the physician has ordered into the nebulizer bowl, and you next have to pre-dilute the medication with saline. Now, I've already pre-prepped this vial, and I'm going to draw off 3 cc's of saline, which I will use to dilute the medication. Okay, you want to gently swirl the medication in the nebulizer bowl, screw the top of the bowl onto it, and we're going to apply this part, which is the T-piece. And the T-piece simply connects the mouthpiece and the collector tube to the device itself. This kind of collects the mist as we're producing it and prevents it from just kind of floating off into the atmosphere and being lost to the patient. We're going to put that on, and we're going to apply the mouthpiece to the opposite side. Lots of patients don't like the idea of your handling the mouthpiece, even if you have gloves on, so it's a good idea to keep the mouthpiece in the plastic packaging until the very last moment. All right, I've checked my med, I've checked my equipment, I've assembled everything. I'm going to make sure that the patient is in full Fowler's position. I'm going to teach them how to take this medication. All right, what I want you to do is to breathe slowly, hold your breath, and exhale slowly. You're going to need to stay upright all times and keep a tight seal around this medication. Can you do that?
Yes, sir.
Okay. I have my oxygen running at 12 liters per minute. I'm going to bump it down to 6. Take the patient off my high flow oxygen. Connect the nebulizer medication, and then the patient is going to take approximately 1/2 of the medication as I instructed, and I'm going to monitor the patient the whole time he's doing it. Periodically, you may need to tap the bowl to have the condensed medication flow down to the bottom so that it can then form the mist. And as you can see, hopefully, it does form a mist that the patient is inhaling as they're taking the breathing treatment. Watch the bowl, and when approximately 1/2 of the medication is gone, stop the treatment. Place the patient back on high flow oxygen at 12 liters per minute, and we're going to assist the patient by taking their vital signs. Okay, close your eyes and look straight ahead. All right, I'm going to check the patient's skin temp, which is still warm and dry. Okay, assuming the vital signs are still okay, we're going to remove the high flow oxygen, place the patient back on the nebulizer at 6 liters per minute. We're going to finish the second half of the medication, take the patient off the nebulizer, back onto the high flow at 10. Okay, we're now going to transport the patient to the most appropriate hospital. The entire time we're transporting, we're going to monitor the patient, including the vital signs, contact medical control as necessary, and request any orders if that is needed, and lastly, document the procedure.